Hello, and welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. So last week, I had the opportunity to speak in a congressional briefing about the TROA Act, which is the Treat and Reduce Obesity Act that was reintroduced to Congress. It had been, I don't remember exactly the date when it was initially introduced, but it didn't go anywhere. And so now with more attention on obesity, medications, obesity being a chronic disease, they have reintroduced this act. And the goal of this act is to expand Medicare coverage to include screening for and treatment of obesity, as well as coverage for FDA-approved medications for chronic weight management. Currently, Medicare does not cover any medications for chronic weight management. And just to have that opportunity to get in front of the people who are making the deals or people who can influence the deal makers was just an awesome experience and a great way for me to be able to share my passion for obesity medicine and why it is a chronic disease. Because of course, you may have friends, you may have family that say to you, oh, just get away from the table and go exercise. But they don't get it. They don't realize that for people living with obesity, this is not their first rodeo. They have had multiple times trying to lose weight. They've restricted their diet. They've exercised more, and still the weight comes back, and still the weight that you can't lose the weight. So there's more to it than just getting away from the table and go exercise. And so to have that opportunity to share that with people who may have that notion and help to dispel that myth was a true honor. And it got me thinking about us as patients, us as individuals in our daily walks and how we can be patient advocates for ourselves. And so today I have our expert, Dr. Sherika Newman. She's a distinguished graduate from the Florida A&M University and a board certified family medicine physician and board certified in hospice and palliative medicine. She founded the Doctor in the Family, which partners with patients and their families, ensuring that they receive care they desire and avoid the care they don't. Her mission is to provide everyone with access to a trusted doctor in the family, ready to assist with medical questions and guidance, which means them being their own patient advocate, them being able to stand up for themselves and getting the care that they need. And so we're so glad that you're here, Dr. Newman, to kind of share all your knowledge.
Thank you.
Welcome to the podcast. I'm so glad to see you.
Thanks for having me.
So before we continue, would you mind maybe telling us a little bit more about yourself and just kind of how you got into this space?
So, I have been doing hospice and predominantly palliative care the majority of my tenure. And I've been out like over 15 years now, I think, somewhere close to the 15-year mark. It's scarce to even say that out loud. And because of my work in palliative care, we do a lot of care coordination because we deal with patients living with serious illness. And so there's a lot of care coordination. And what I found is a lot of patients and their families are unsure sometimes of how to converse with doctors or the medical team. They're unsure of what to ask and what not to ask. Or when we walk out of the room, they're unsure of what we even said to them, And so a lot of things get missed, and it's like two ships sailing in the night to get us back on track. And so just with that experience and then my own personal experiences, I'm sure, just like you, Dr. Shelly, a lot of your friends and families send you messages about what doctors have said, or you get the picture in the middle of the day with what is this. And so there's a lot of room for advocacy in the medical field to help people navigate stuff and really align medical treatment with who they authentically are. It's what we call patient-centered care, right? So it's helping people do that is so important and vital to me because there are so many treatment options. We've overlaid medical care, right? But making sure you're getting the treatment that matches you is invaluable to me.
Okay, excellent. Well, for those who may not quite understand, can you define what is patient advocacy?
So patient advocacy is someone who basically stands in the gap for you or helps you or teaches you to stand in the gap for yourself to advocate or talk on your behalf to make sure that you're getting what you need, make sure your needs are met, make sure what you want is getting done and what you don't want is not getting done, especially in times where you can't talk for yourself, right? Whether that's an emotional barrier, a mental barrier, a physical barrier, you're unconscious, you need someone that's going to speak on your behalf to make sure you're still cared for in the proper way. And so that's an advocate.
Why is it important to have a patient advocate? And can that patient in themselves be an advocate, or do they need someone to stand in for them?
So Both. So I think we need definitely good self-advocacy. And my practice does self-advocacy. I help prep people for appointments. I help them review their labs and their radiology reports so that they know what to say. So self-advocacy is important, but you also need someone who can carry on what you want to say in the times you can't, right? Whether it's you're very ill and can't speak for it, or, sometimes when you're sick, you're just overwhelmed. And if someone could just step in and have that dialogue for you, that is so helpful. And so I think self-advocacy and a patient advocate outside of yourself is very important.
Now, how does one find, I know you say you help people being that advocate, but let's say if they're not necessarily in your area, who would be the best advocate for, or how does someone find somebody to go with them to the doctor or to be that advocate for them?
So most people find us by referral from another doctor, or find us by referral from someone who's used an advocate, or a lot of times estate planners and medical managers know about us and say, hey, I think you need an advocate on your side, right? Like I have a medical advocate person that I think you need, and refer that way. Or some people do the, tried and true Google and find us. So a lot of different types of advocates, whether you're a nurse advocate, a medical biller, it's a lot of different types. But it's very few advocates who are physicians and truly physician trained. And I think that provides a different layer because there's a different peer-to-peer conversation that can go on when you have a physician advocate.
So can somebody use their family member as an advocate? Like, what if they're not necessarily in your area? So who else can they go to for that advocacy, I guess is the question, or who should they be seeking?
So yeah, I think they can. I think most times it is our family or loved one advocating on our behalf. That's how it's done most of the time. But people tend to get outside advocates when they are stuck, right? When you don't understand what's going on, even as a family member. So I always look at my treatment unit as the patient and their family, because a lot of times the patient is just overwhelmed. You can't keep up. And I always advocate for an extra set of eyes and ears in the room, right? That never hurts. Someone writing notes or writing stuff down for you, if you can't for yourself. So I think that's the first layer of advocacy, your friends or family, after self-advocacy. And then definitely bringing in an advocate, a higher independent advocate if things get complex or complicated or you're just so overwhelmed. A lot of times it's the son who's out of town, right? Mom is here, but I'm out of town and I can't make it to the appointments. But as the son, I really need to know what's going on so I can help my mom make good decisions.
Great. All right. So let's think about how we can use patient advocacy in weight loss and that management. I guess with that one, it's not necessarily as severe as like maybe, well, I guess the question is, does it have to be when you're stuck? Or like, I guess, is there other times where you can use an advocate where it's maybe not as severe?
Yes, I think people use day-to-day advocates. I have been there for people on their day-to-day things as far as medical stuff. Usually at the beginning of something is when we develop the relationship. But I think because what you just said, we are really learning a lot about obesity in this day and age. Actually, my very first paper in residency was about obesity. And it's because even in residency, I recognized that we were not treating it right and we weren't looking at it right. And I knew back then it was more than calories in, calories out, right? And so I think, to me, any medical disease could bring on an advocate, whether it's high blood pressure, because I don't know about you. That's one of the things I tell people in self-advocacy. You should know your diagnosis and the treatments, the medications you're taking that aligns with that diagnosis. And patients don't. And sometimes they're just overwhelmed and they have all these pills and they don't even know who's on first and what's on second, right? So just getting in there, helping them straighten that out, at least one round robin of that usually does very well. And I think the same thing for obesity. Like you said, there's so many people living with obesity who have been through this so many times and had so many heartbreaks and so many failures that there comes a bit of hopelessness, even maybe depression, mild depression that comes as a comorbid to obesity itself, right? There's that psychological component that we didn't know a lot about until recent years. I mean, Contrave was the first one to kind of speak about that psychological, the neurological component to obesity and how we can quiet the food noise. That's all new, but it's new to us. It's not new to the person who's been living with obesity however many years, who have been in this war by themselves because they didn't feel heard by the doctors, right? So I do think there's a form of advocacy there. And a lot of times my patients that I treat for obesity or help get their obesity medicines, a lot of times I'm helping them develop the language to have that communication with their medical team that helps them take the sting out of it. Because, sometimes when we're bruised or injured, we can go in hot, hot and heavy. And that's not always the good way to advocate. I tell my patients, be assertive, but not aggressive, because aggressiveness won't get you anywhere in healthcare, but assertiveness will. And just teaching them how to do that dance with your medical team, even in the midst of feeling defeated, is so important. And I think the more we get behind it, legislative and regulatory wise, it'll be helpful. But I think that psychological component is a part that's going to need its independent addressing, even in this landscape of poor mental health in the States.
All right. Well, why is it important for before I say that, how you mentioned there's a couple ways how people should not advocate. You said they should not be aggressive. Is there any other way they should not advocate or not go in that way? Like you mentioned, sometimes people get really angry with their doctors and you just don't never get anywhere. But is there any other things people should avoid?
I think they should also avoid pitting two disciplines against each other, right? So sometimes it's not easy to understand maybe what one discipline is saying over the next, like what the heart doctor is saying, and it sounds different from what the kidney doctor is saying. And you go in saying, but the kidney doctor told me this, and you're saying this. No, it's two different specialties, and they are saying stuff differently, but it's all going to align. So I don't think it's good to try to pit doctors against each other or try to antagonize in that fashion either. I think the best thing to do is to stay curious, right? As a patient and as their loved ones, you got to stay curious about what's going on, but also be open-minded and detailed. That's why having notes is important, even if it's just high blood pressure. A lot of times, I don't know if you have it, Dr. Shelly, patients come in, I tried some medicine, it didn't work. Well, which one? They don't know. But having that information is very critical to you getting the care you want and not getting what you don't want, right? It is essential to it. And so just going in curious and open-minded and not trying to pit or not being aggressive, not letting your injury be in the room, not letting your injury lead your conversation is like the big umbrella. How it outpictures is different.
And how should a patient come when they're seeing their doctor? Like you mentioned, they should be taking notes. Should they bring their medications? Is there something else they should be doing?
I think you should always have your medications with you, the medicines you're actually taking, even the over-counter medications, right? We need all of that, right? So you should always have your medication, not the list, the actual medication bottles. Bring them with you to your doctor's appointments. I think you should also have a list of any consultants or specialists you see. And if you can, the reason you're seeing them, right? So that's also important. Any recent studies like, I just got my blood drawn at the kidney doctor. Okay. If you don't have the lab results, at least tell us that you had some recent blood work or whatever drawn. Keep your doctors updated to what's going on. I'm a sports girl. So I look at medicine like a sport, and your primary care physician is your quarterback. I mean, they're putting the ball in everyone's hands, right? But those other players, whether it's the wide receiver or the running back, when they have the ball, the quarterback still needs to know. So if you're going to another specialist, your PCP still needs to know that. And that's an important thing. So you want to always bring as much information to the doctor's appointment as you can, even the specialist, right? Because your body is one system and all of it works together. Your heart needs your lungs just as much as your lungs need your kidney. And all of your brain needs it too. So it all works together, even though we're specializing in different things. So I think just I always tell my patients, get a card from all of your doctors and just tape it on the front of something. And so that way you just have all your doctors taped on the front of a notebook. And even if your aunt took you to the doctor this time, but your brother has to take you the next time, you're just passing the notebook or passing the notes in our phone. Either way, but keep some type of record that is kind of updated.
Well, any last advice you have to the audience today about being a patient advocate for themselves and with their care?
I would say, and what I say to my patients often is it is weary. Sometimes healthcare system, navigating it can be weary, but you deserve the care you want. And so don't get off the horse, right? Don't give up. Don't throw your hands up. No, stay in the thick of it and make sure that you're having conversations and communicating with your healthcare team to get the care that you deserve and that you want for yourself. I don't care what insurance you have. I don't care what diagnosis you have. I don't care how many medications you take. Just make sure that you're getting the thing that you feel you deserve. And we all deserve good care.
All right. Thank you so much. Well, thank you so much for coming on and sharing your information and how we can be advocates, not just for ourselves in the doctor's office. But the one thing I will implore people is that they should be advocates for at their work job. If their job or employer does not cover obesity medications, go and see what you can do, whether you need to get a petition of people at the work so that they see that it's something that's necessary for them to have so they can be able to have an added benefit for its employees. And then don't forget that you can persuade your congresspeople, your state legislation as well, to make sure that they are covering the treatments for obesity. So in conclusion, would you mind sharing where somebody can work with you and or find you?
So you can find me. I'm on all social media platforms as my name, Dr. Sherika Newman. I'm also available by consult. You can call my office, 404-900-8654. And then my website is my.ditf, doctorinthefamily.com.
All right. Thank you so much. And for everyone else, thank you for joining us on the Back on Track Achieving Healthy Weight Loss podcast. If you like this episode, please share with others, like it and subscribe, and don't forget to leave a 5-star review. Have a great day.